From the day 6 to 13, follicles develop in ovaries, while in the uterus, endometrium is restored. The estrogen rises to maximum and the FSH rises a bit. In the day 14, the egg bursts from the ovarian follicular cells, differentiates into the corpus luteum. In the uterus, endometrium gradually thickening, and then the estrogen drops sharply and LH surges. In the last phase that occurs in the 15th day and to the 28th, the corpus luteum is maintained slowly, degeneracy fertilization doesn't occur. In the uterus, endometrium thickness to maximum and the hormones are the estrogen, progesterone rises, then falls if fertilization doesn't occur, and FSH and the LH are inhibited. The relation between the ovarian and uterine cycles is that both are controlled by chemical messengers or hormones. Gonadotropin releasing hormone, that is the GnRH, is secreted by the hypothalamus and stimulates the release of follicle-stimulating hormone and luteinizing hormone from the anterior pituitary gland. FSH in turn initiates follicular growth and secretion of the estrogens by the growth follicles. LH stimulates the further development of ovarian follicles and their full secretion of estrogens, brings about ovulation, promotes formation of the corpus luteum, and stimulates the production of estrogens, progesterone, relaxing and inhibiting by the corpus luteum.
Now I'm going to describe the procedure, methodology, effectiveness, and risk of 10 available birth control methods, and I'm going to identify the ones that are also effective in preventing STD. First, we have abstinence, which consists in not having any type of sexual intercourse or sex play with a partner. It is very effective. It is the only birth control that is 100% effective in preventing pregnancy as well as sexually transmitted diseases. There are no risk of side effects of health related to abstinence. Then we have vasectomy, which is a male sterilization surgical procedure. It is one of the most effective kinds of birth control out there and the most effective method for people with penises. Vasectomies are almost 100% effective at preventing pregnancy. A vasectomy won't protect you from sexually transmitted infections. Semen can still carry STDs even if it doesn't contain sperm. There are a potential concern with vasectomy, which is that you might later change your mind about wanting to father a child. Then we have tubal ligation, which is a surgery to close a woman's fallopian tubes. Its effectiveness is really great at preventing pregnancy, more than 99% effective, and it doesn't protect you or your partner from STDs. The risks of this birth control method are damage to the bowel, bladder, or major blood vessels, adverse reaction to anesthesia, improper wound healing or infections, and prolonged pelvic or abdominal pain. Then we have the contraceptive implants, which the birth control implant is a tiny, thin rod about the size of a matchstick. The implant releases hormones into your body that prevent you from getting pregnant. The effectiveness of this method is more than 99% effective. That means fewer than 1 out of 100 women who use the implants will get pregnant. The implant doesn't protect you against STDs. The risks of this birth control method are an increased risk of non-cancerous ovarian cysts, changes in vaginal bleeding patterns including absence of menstruation, decreased sex drive, sore breast, vaginal inflammation, or dryness. Then we have the IUD. An IUD is a tiny device that is inserted in your uterus to prevent pregnancy. It's long-term, reversible, and one of the most effective birth control methods out there. Its effectiveness is more than 99% effective. That means fewer than 1 out of 100 women who use an IUD will get pregnant each year. IUDs don't protect you against STDs. The risks of this birth control method are perforation, infection, and expulsion.
Another birth control method is the diaphragm, that consists in a form of birth control that's a shallow cup shaped like a little saucer that's made of soft silicone. You bend it in half and insert it inside your vagina to cover your cervix. The methodology effectiveness is that here's the deal on diaphragm effectiveness. If you use your diaphragm perfectly every single time you have sex, it is 94% effective. But nobody's perfect, so in real life diaphragms are about 88% effective. That means about 12 out of 100 people who use a diaphragm will get pregnant each year. Diaphragms don't protect against sexually transmitted infections. The risk is that the most common side effect you could experience from using a diaphragm is vaginal irritations, latex allergies, history of toxic shock syndrome, or irregularities of the vagina or cervix could create additional risks. A male condom is a fine barrier which is rolled onto a man's penis before sex. It is used as a barrier to stop sperm and infection passing between sexual partners. It is usually made of rubber. If you use condoms perfectly, they are 98% effective at preventing pregnancy. But people are imperfect, so in real life, condoms are about 85% effective. That means about 15 out of 100 people who use condoms as their only birth control method will pregnancy each year. Condoms are great at preventing both pregnancy and STDs. The risk is that male condoms do not have any side effects except to individuals who are allergic to latex, while female condoms are alternative to regular condoms. They provide pretty much the same great protections from pregnancy and STDs. If you use it perfectly, it has the 95% of effectiveness, but in real life it has only 79% of effectiveness, and is about 21 out of 100 people who use condoms will get pregnant. Female condoms are great preventing pregnancy and STDs too. The female condoms do not have any side effects except to individuals who are allergic to latex. The coitus interruptus is the method of ejaculation outside the vagina. It's a form of protection against pregnancy in which semen contact with the vagina is prevented. The more you can practice this method correctly, that is, prevent the semen from coming into the contact with the vulva and the vagina every time you have sex. Of every 100 women who use the method of ejaculation outside the vagina correctly, 4 become pregnant. Using the withdrawal method to prevent pregnancy doesn't pose any direct risk, but it doesn't offer protection from sexually transmitted infections. Some couples also feel that the withdrawal method disrupts sexual pleasure. And then we have the morning after pill. The morning after pill is a commonly used name for a tablet that is taken after unprotected sex to prevent pregnancy. It has 95% effective if taken within 12 hours of unprotected sex, 95% effective if taken between 12 to 24 hours of unprotected sex, 75% effective if taken between 24 to 48 hours of unprotected sex, and then 58% of effectiveness if taken between 48 to 72 hours of unprotected sex. Some risks are nausea or vomiting, dizziness, fatigue, headache, breast tenderness, bleeding between periods or heavier menstrual bleeding, and lower abdominal pain or cramps. It doesn't provide protections against STDs.